Welcome, everyone. Thank you for joining us for this podcast at Bless the Child Foundation. We're here to highlight the key areas of child health. And with me in studio, we have our very good guest, Simon Kasaga, who's here to also show us and tell us what Bless the Child Foundation is and what they have done and how they have impacted on children who are affected by cancer. Simon Kasaga is our house manager at Bless the Child Foundation. Please let us know and give us a few details of your background, both with Bless a Child Foundation and where you're coming from.
All right. Thank you so much, Isaac, for again giving me an opportunity to come and talk to our audience, our donors out there, well wishers. As Isaac said, my name is Simon Peter Kasaga, and I am a home manager. I've worked with Blessed Child Foundation for quite some time. You talked about my background. I think my background and then Blessed Child Foundation's background. I'll start with mine. Mine goes back down to when I was a fresh graduate a few years back. And when you're a fresh graduate, you're still looking at things that you can do, things that can make you understand the world or see the world differently. And here I landed on Blessed Child Foundation, an organization that takes care of children suffering from cancer between the ages of 0 to 15 years. In my mind or in my entire life, I'd never seen myself working with children because I didn't have that. We all have different dreams, and I had a different dream. But fate opposites came and crossed each other, so I made myself here, and I loved the place. I liked it. The very first time I walked in, seeing children with disfigured faces, huge tumors on their faces, I was like, what's going on? I didn't know about childhood cancer. I didn't know that cancer could do that to someone. They didn't have hair. So I asked, oh, what's wrong? They said it's because of their treatment. And they gave me a story where I got to learn that Blessed Child Foundation goes back down to 2007. I believe most of us, the viewers, were still young back then. And this is when the founder, Brian Olusimbi, made a Smile Again party for the children at Uganda Cancer Institute. And he said back then people were sleeping on verandas when at the hospital. They were sleeping in hospital corridors, congested, suffering from other illnesses aside cancer that they were trying to treat.
Yes.
And he said he needed to open up a space where these children could get accommodation, meals, transportation to and from the hospital, psychosocial support for the families, because children and their families they come from villages really, and it is very hard for them to try to walk or transport themselves from where they come from to the hospital every single day, because the main treatment center for cancer is in Mulago Hospital, and many people come from villages to come and get that kind of treatment. So imagine the kind of transport that you spend on a daily.
So meaning someone who's coming from northern Uganda, deep, let's say in Gulu, for them to come here between on a weekly basis would be so hard. So BCF was the linking.
Yes. So you asked a very good question. I would go back to how where you come from every day to come and work, with the children, see them, the money that you spend. Sometimes it gets hectic, really. You look at your pocket and you're like, you're running dry. So imagine someone that has to use about between 50,000 to 100,000 every single day. That's without meals, without the medical bills that they need to cover every day, only transportation. So here at Blessed Child Foundation, we give all that for free. Come here, rest, go to the hospital the next day for your appointment, come back and rest. Free of charge. We don't charge you anything. For all the services that we provide, you don't have to pay.
Wow. So, ladies and gentlemen, tuning in on this podcast, you can see we have a hero in our studio today. So, it tunes in with our theme of Meet the Heroes. Simon, we're really blessed to have you. I believe your background before you even entered Blessed Child Foundation really put you in on this path of helping the children. Could you highlight us and tell us more on how that happened?
I'm a research enthusiast, first of all. I like reading. I like knowing more about different things. So sometimes you find yourself that the little that you could have skipped gets you to the biggest part. I'll go back to when I had a family member that was suffering from one of a few, okay, maybe many, I don't know, depending on your perspective, the non-communicable diseases that we have. So this drew me into finding out about childhood cancer. And I was like, what is that? What is it all about? I saw different pictures. Then when I went to the Google search, the first organization that came to the search was Blessed a Child Foundation, and it was close by. So I said, how about I spend time, pass by and see, visit, get to understand, see for myself physically, without now reading what I've seen online. So I came here and it was actually a reality that people actually exist with such tumors. So I said, okay, what exactly is going on? What is this? Are they going to die? He said, no, we have survivors, success stories, people make it. I said, so I had to ask like very many questions. The first thing I was like, what can I do to help? How can I be a part of this? He told me you can become a volunteer. Come and play with the children. Do this, do that. Get yourself involved in the kitchen. All the works that Blessed Child Foundation does. And here I was asking because I was super excited, but then the downside was I was kind of scared because I thought it is it can be contracted that when you have it and then you touch me. Then I got all this information, and when I went back home I had to read, understand how best can these people be made feel like normal children that play. Can they play like other children? Eating, is that a specific that they are supposed to be given on a daily basis? And it so turns out that all these things we have at the back of our minds, not until we get to see or interact with these people. Yes, so me back then I didn't have that much information, but coming here, getting to see for myself physically, drew me closer into understanding and then wanting to make a change in these children's lives and then their families.
So, Simon, I believe from what you've said, basically, Bless a Child Foundation demystified what child cancer is.
Yeah, sure.
And in that same vein, I would want you to give us an overview of what Bless a Child Foundation has been doing, where it has come from, and how are they here? How are they able to do what they do now? How long have they been in this sector?
For someone that is out there, I would want to let them know that the work that we are doing or the work that we do didn't just happen overnight. It's been 15 years of experience of hard work, toil, inputting quite a number of things, developing programs, letting go of different programs, bringing other people on board to see how best we can have this. So when we are talking about 15 years, I would say the very first year we opened up the very first home, Akiba Home. This home right here was opened up in 2010. And that brought in a lot of people. It gave us another kind of perspective or another kind of light in terms of child treatment, that people actually needed this kind of space. At the hospital, they would, wake up, go, but then at night, where do you get your kind of rest? Because when it comes to treatment, even any other kind of illness, you need to rest. And when you're resting, you need a comfortable space, a comfortable bed, a cozy bed, a nice meal at the end of the day, right? So we opened up all that, and then when we opened up our very first home, this home right here, we saw changes at the hospital. It was now decongested. People were running away. People were now getting time to go back home and spend time with their families. So we said, how about to open up more homes? And right now, as we speak, we have 4 homes in the country, yes, in Uganda. And this year we opened up another home in Kenya, which is also serving now the Kenyan part. We are going regional. We want to go Africa-wide and then see ourselves having very many homes that are helping these people curb childhood cancer, especially to make sure that they are able to access, start and then complete treatment.
Okay, it's good you have touched on that aspect. We would want to know what is the main objective of Bless a Child Foundation, because if we have gone through all that process, you must be going somewhere. So what is your destination as Bless a Child Foundation?
First of all, I would tell someone that we want to see the rate of treatment abandonment in the country when it comes to childhood cancer go down. That people between, or the children between the ages of 0 to 15 are able to start and complete treatment. We want to see that at the end of the day, every time someone is diagnosed with cancer, the moment they are started on treatment, they're able to finish it. That gives you a whole chance of survival rather than you starting and then breaking down or breaking out of treatment. You've started and then you're abandoning due to some reasons. Because the reasons that are always there have monetary terms, in monetary terms, food, accommodation, transportation, because people cannot afford. So how about us giving all that to you at no cost? The only thing that you have to do is be able to wake up in the morning, take your child to the hospital, bring them back, let them rest. So for us, we want to see that all that happens, and then in the end, when you look at, okay, I don't know how many people go around, but then the WHO has a GICC goal of bringing down childhood cancer, the reduction or in treatment abandonment to 30% by the year 2030. So we want to contribute to that. So we are now running onto that objective as well. It was our objective back then, but then when the goal came in, we had to intertwine with the goal. We had to come in sync with the goal and see that everything now aligns with everyone, because globally there are very many organizations doing what we do, and then they're also in line with that. So for us, we said let us handle the East African part.
Okay, so in that same vein, in terms of statistics wise, do you have offhand how many children have passed through Blessed Child Foundation's hands over the years?
Well, I may not give you the accurate figures, but I would say we've taken care of over 10,000 children since we opened up, all these homes. Actually, since we opened up the very first home, Akiba.
Impressive.
Yes.
So the reason why I brought that up is, in terms of your objectives as providing care to the children, what else do you add to the children? Because if they live here, what next? What else does Blessed Child Foundation do for the children when they're here and after?
All right. So I would let me go for our class program or our education program, the remedial classes. Sometimes people come here when their children have not been to school or when they have dropped out of school. So when a child goes on remission, when they go back home, maybe declared cancer free, or they've been given cancer treatment breaks, and then they have to return, we make follow-up calls. We do follow-up. We go and check on them, see. We monitor, how are they doing, how are they faring. In case the child was in school and then they're not able to go back in school due to some instances that happened along the way, parent must have lost their job, things like that. So we have programs that equip mothers and then or even all the caregivers to have these life-saving skills. Under the psychosocial support program that we have parent support groups. They get to learn different things, money making skills. When you go back home, we have a seed that you go back with. You write proposals, we look at your proposals, and then we fund. In that you as a family can be able to take care of the child and as other siblings that you left the other side, right? So as Blessed Child Foundation, we ensure that when a child goes back home, are they in school? Here you've been studying, we want to follow up. Are they continuing with their education? If not, can we find them a school close by? We talk to schools. Schools give people scholarships, especially in the western part of the country. We have so many children that have been given scholarships or bursaries to go and study for free because of the ailment. It wasn't their fault that they have the sickness. So schools come in and they want to give back to community. It's like a social corporate responsibility, and like we want to help.
Okay, Simon. So basically, Blessed Child Foundation gives a 360-degree care to health
children.
care to the children.
Yes.
So you had it here first. That's why we said meet the heroes. And today we have a hero straight from Blessed Child Foundation. Stick and tune in with us for the next part of the segment. Keep watching.